Do you know what lupus is and how it affects the body? If not, don't worry, you're not alone. This puzzling and complex disease is not as well known as other illnesses, but it has a profound impact on millions of lives worldwide. Lupus, in its essence, is a chronic autoimmune disease. Now, what does that mean? Let's break it down. Chronic means that the symptoms last for a long time or occur often. Autoimmune refers to your immune system, which is designed to protect your body from disease. But in the case of lupus, your immune system turns against parts of your body it's supposed to protect. This can damage any part of your body, including your skin, joints, and even organs. Now, there isn't just one type of lupus. In fact, there are several, each with its own unique characteristics and symptoms. The most common type is systemic lupus erythematosus, often shortened to SLE. This form of lupus can affect any part of your body and cause widespread inflammation and damage. Then there's discoid lupus, which mainly affects the skin, causing a rash that doesn't go away. Subacute cutaneous lupus also affects the skin, but in this case, the person develops sores after being out in the sun. Drug-induced lupus, as the name suggests, happens after taking certain prescription medications. The symptoms are similar to systemic lupus, but they usually disappear once the medication is stopped. These types of lupus can manifest differently in different people, making this disease a bit of a chameleon in the world of medicine. It's a disease that presents an array of challenges not just in diagnosing and treating it, but also in living with it day to day. Now that you have a basic understanding of what lupus is, let's dive deeper into the symptoms of this disease. Because understanding lupus doesn't just stop at the definition, it's about recognizing its signs, knowing how it can affect the body, and ultimately, learning how to manage and live with it. So, stick around as we continue to unravel the mystery that is lupus. So, what are the symptoms of lupus that we should be aware of? Lupus, a chronic autoimmune disease, manifests itself through a variety of symptoms that can range from mild to severe. These symptoms often come and go, making it somewhat challenging to pin down. However, there are common indicators that may signal the presence of lupus. One of the most common symptoms is fatigue. Nearly 90% of people with lupus experience some level of fatigue. It can be mild in some cases, but in others, the fatigue can be so severe that it interferes with daily activities and functioning. Joint pain is another common symptom. Lupus can cause pain, stiffness, and swelling in your joints, similar to the sensations experienced by those with arthritis. This can make movement difficult and can significantly impact a person's quality of life. Rashes are also a telltale sign of lupus, particularly a butterfly-shaped rash that spreads across the cheeks and the bridge of the nose. This rash is so characteristic of lupus that it's often a key factor in diagnosing the disease. Other skin symptoms may include color changes in fingers and toes, and sensitivity to the sun resulting in rashes or sores. Fever is another symptom that often accompanies lupus. These fevers are usually low-grade and may come and go, much like other symptoms of lupus. They can also be a sign of inflammation or infection, so it's crucial to consult a healthcare provider if you're experiencing frequent, unexplained fevers. Keep in mind, though, that lupus is a highly individualized disease. This means that the symptoms can vary greatly from one person to another. Some people may experience only a few mild symptoms, while others may have many symptoms that are severe. It's also important to note that these symptoms can be associated with many other health conditions. Therefore, experiencing these symptoms doesn't necessarily mean you have lupus. However, if you're experiencing a combination of these symptoms, especially if they're persistent or unexplained, it's advisable to consult with a healthcare provider. Understanding how lupus attacks the body can help us better manage these symptoms. But how exactly does lupus attack our body? To answer this question, we first need to understand the role of a healthy immune system. Usually, our immune system is our body's personal security guard, protecting us from harmful intruders like viruses and bacteria. It does this by producing proteins called antibodies that fight off these harmful invaders. However, in the case of lupus, something goes awry. The immune system gets confused and starts producing autoantibodies, a type of protein that, instead of protecting the body, begins to attack it. It's like our body's security guard suddenly turns against us, causing inflammation and damage to our own tissues and organs. Now let's take a closer look at how lupus impacts various organs. When the heart is under attack, it can lead to inflammation of the heart muscle or the lining around the heart, causing chest pain and other symptoms. If lupus targets the lungs, it can cause inflammation of the lung tissue, making it harder to breathe. When lupus strikes the kidneys, it can lead to a condition called lupus nephritis, which can cause swelling in the legs, high blood pressure, and even kidney failure if not treated promptly. Lupus can also wage war on the brain, leading to headaches, dizziness, and problems with memory and concentration. And that's not all. Lupus can also affect the skin, causing a distinctive rash over the cheeks and nose, often in the shape of a butterfly. It may also cause hair loss, mouth sores, and sensitivity to the sun. Lupus is a complex and multifaceted disease that can impact different people in different ways. It's not just a one-organ show, it can affect several parts of the body, making it a systemic disease. This complexity is part of what makes lupus so challenging to diagnose and manage. Now that we know how lupus attacks the body, let's talk about the available treatments. Treatment for lupus is not one size fits all. So, what are the options? When it comes to treating lupus, the strategy is often as unique as the individuals who live with this complex condition. The aim is to reduce inflammation, manage symptoms, and prevent flare-ups. And there are several medications that may be prescribed based on disease progression and severity. Let's start with hydroxychloroquine. This is a standard treatment for many lupus patients. It works by reducing inflammation, which helps to alleviate joint pain, rashes, and the fatigue that often accompanies lupus. Next up is diclofenac, a medication that helps manage joint pain and inflammation. Like all medications, it should be taken under the careful monitoring of a healthcare provider. Now, for those grappling with muscle pain and spasms, there's methocarbamol. It's used as needed and can provide much-needed relief. Then we have Benlysta, a significant milestone in lupus treatment. It's the first FDA-approved medication specifically for lupus and lupus nephritis. Benlysta requires monthly infusions and can make a huge difference for many patients. Prednisone, a type of corticosteroid, is often used for specific symptoms and in short bursts. It can be very effective but needs to be managed carefully due to potential side effects. Methotrexate is another medication that may be used. It's an immunosuppressant that reduces the immune system's activity in lupus. And like other treatments, it must be carefully monitored. Lastly, there's Ultram, also known as tramadol. This medication manages pain, including lupus-related pain. It's an opioid, so it's very important that it's taken under the close supervision of a healthcare professional. Remember, it's crucial to work closely with your healthcare provider to create an individualized treatment plan. Lupus is a complex condition, and what works for one person may not work for another. Regular checkups and open communication with your healthcare team will ensure that your treatment plan is working for you and can be adjusted as needed. Treatment is crucial, but so is maintaining a healthy diet. What role does diet play in managing lupus? Diet, while it's not a cure-all, plays a crucial role in managing lupus. It's the fuel that keeps your body running, and the better the quality of that fuel, the better your body can function and fight against inflammation and fatigue, two major symptoms of lupus. Let's start with hydration. Staying well hydrated is key for everyone, but particularly for those with lupus. Water helps keep your body functioning optimally, aids digestion, and can even help combat fatigue. As for food, a balanced diet is essential. Think of it as a colorful plate, full of fruits, vegetables, lean proteins, and whole grains. These foods are rich in antioxidants, vitamins, and minerals that can help your body repair itself and stay strong. There's a special shout-out for fatty fish like salmon and mackerel. They're rich in omega-3 fatty acids, which are known for their inflammation-fighting properties. So, including them in your diet can be beneficial. On the flip side, there are certain foods you might want to limit or avoid. Foods high in salt can lead to water retention and high blood pressure, so it's best to keep them to a minimum. Similarly, foods high in sugar and saturated fats can trigger inflammation and lead to weight gain, which can put extra strain on your joints. Alcohol and caffeine are two other substances to consider. While moderate consumption might be okay for some, they can interfere with sleep and medication effectiveness, so it's worth discussing with your healthcare professional. And remember, everyone's body reacts differently. What works for one person might not work for another, so it's important to pay attention to how your body responds to different foods and adjust your diet accordingly. Lastly, while diet is important, it's just one piece of the puzzle. Regular exercise, adequate sleep, and stress management are equally important in managing lupus, along with following your prescribed medication regimen. With proper treatment and diet, reaching remission is possible. Reaching remission is the goal for any lupus patient, but what does that mean? Remission, in the context of lupus, is a period when the disease is well controlled and the patient is free from symptoms. It's like a ceasefire in the battle between your immune system and your body. However, this doesn't mean the war is over. Lupus is a chronic illness, meaning it's long-lasting. While there might be times of peace, flare-ups can occur when you least expect them. Now you may wonder, what prompts these flare-ups? The triggers can vary from person to person. It could be stress, a sudden change in weather, a minor illness, or even unknown factors. The unpredictability of lupus is part of what makes it such a challenging disease to manage. But there's hope. In fact, the very word remission is a beacon of hope. It's a testament to the fact that lupus can be controlled, that there can be periods of relief. Now, reaching remission doesn't happen overnight. It's a journey, and like any journey, it's filled with ups and downs. But with a strong healthcare team, a well-tailored treatment plan, and a dose of resilience, it's a journey that many lupus patients successfully navigate. Of course, even during remission, it's crucial to keep up with regular checkups. This is like the reconnaissance mission in our war analogy. Regular medical visits allow your healthcare team to monitor your condition closely, adjust your treatment plan if needed, and help prevent or manage potential flare-ups. While remission doesn't mean you're cured of lupus, it does mean that your quality of life can significantly improve. So if you're living with lupus, remember this: remission is not just a possibility, it's a probability. And with the right care and support, you can reach it. This concludes our journey into the world of lupus. We hope this series has shed some light on this complex condition, and remember, you're not alone in this fight. We're all in this together. Thank you for watching. Don't forget to subscribe and like for more content like this.